excuse me, and which is attention deficit hyperactivity disorder. They picture hyperactive young boys struggling to sit in class, but growing evidence of ADHD is significantly undiagnosed and misunderstood, especially in women and girls, and often leading to years of silent struggle. Now, as South Africa marks Women's Month, the South African Society of Psychiatrists is calling for greater awareness on how ADHD presents differently in women and why so many go undiagnosed well into adulthood. According to global data from CDC, boys are nearly twice as likely to be diagnosed with ADHD as girls. And for those women who do get diagnosed, it often comes years, maybe even decades after symptoms begin. Well, to help us understand this phenomena and this gender gap and what can be done about it, we're now joined by Dr Lavinia Lumu-Thabete, who's a member of the South African Society of Psychiatrists. Thank you so much indeed for joining us, and welcome to the program to you, Dr. Lumu-Thabete.
Thank you so much, Peter, for having me and to discuss this very important topic.
All right, let's start with the basics. I mean, what exactly is ADHD and how is it typically diagnosed?
So ADHD is essentially a neurodevelopmental disorder, meaning that a person is probably born with it, and it's influenced by how the brain develops. Essentially, what happens is that in the frontal lobe, which is your part of the brain that's responsible for executive functioning, like planning, organization, the one of the hormones, dopamine, is not enough. So essentially, how it then manifests is in behavioral and other problems that affect one's ability to think clearly and focus. So there are many components to it, but there are three types of attention deficit hyperactivity disorder. You have the hyperactivity type or the impulsive type, which often affects boys, where you see a child running around, can't sit still. And then there's a quieter one, which is the inattentive type, which tends to affect girls more, whereby the person cannot concentrate, cannot focus, gets easily distracted, and daydreams.
All right, so the issue at hand here is why the condition is so overlooked in women and girls. Do we know why?
The issue is overall with ADHD, there's a lot of stigma around having the diagnosis of ADHD, and what often happens, it's only the hyperactive type or the impulsive type that gets picked up and it typically affects boys. So they're the ones that are disruptive in class, whereas a child tends to have the more inattentive type of ADHD, where they are daydreamers, they drift off, they can't focus, and because of that, because the girl is usually sitting quietly, that's why it's often missed.
What are some of the common symptoms in ADHD in women, especially those that may be misunderstood or missed entirely?
So one of the common things is that often because the girl sits quietly in class, she's often missed. But the impulsivity can manifest and carry on into adulthood. With ADHD, they did think that, most people grow out of it. But what we are starting to see is that up to 60% of people carry on with ADHD into adulthood. And specifically in women, the impulsivity and the inattentiveness can persist. It can manifest with impulsive shopping or buying excessively, binge eating. It's often misdiagnosed as anxiety or depressive symptoms. Sometimes when the symptoms are present, a lot of women then try to compensate by being overly perfect, trying to be a perfectionist, to try and compensate for this condition. And also, there's a lot of other symptoms whereby, though, there's a lot of chaos in terms of being disorganized and a need to people please, and that can result in difficulty in setting boundaries and leading to burnout. So it's very difficult to pick up, and I think in women they do get misdiagnosed as a result.
I think you might have given us some clues in terms of my next question. Undiagnosed ADHD in women, this must affect a number of areas in their lives. Mental health, careers, relationships, maybe even self-esteem.
Oh, definitely. Imagine not being able to keep up in a meeting or in friendships and relationships, remembering important things. That can have problems in relationships, and especially for women. Women already are expected to multitask quite a bit, especially entering into motherhood. The impulsiveness of doing things can result in debt, in difficulty in staying in one job because of these symptoms. And the challenge is, it comes in varying degrees. So depending on the severity of symptoms will determine the severity of comorbid mental health issues that the woman can present with.
I suppose awareness is a big challenge. Is there enough knowledge that maybe even our first healthcare providers have, like our GPs, first line of call? Do you think they know enough to be able to recognize these symptoms?
Well, it is challenging in making the diagnosis of ADHD, especially in a GP setting. But one of the clues could be related to when someone is struggling in work or academics. I think those are some of the clues to look out for. Usually in more than one setting, one would have symptoms. And the treatment is available. And I think the biggest challenge is currently the treatment for ADHD, when required, is quite expensive. It's extremely expensive, and it's not really covered and not easily available in government settings and also in the private sector. What we find is some forms of medical aid would probably pay for the medication if a person is of school-going age. But the challenge is when the person goes out into sort of furthering their career and personal lives. And specifically for women, I think because of the misdiagnosis, some women go through years and years of being misdiagnosed with something else, medications not responding, and meanwhile, all they had was ADHD.
State institutions, hospitals, do you think that they take it as a serious condition, or is that part of the reason why there's not enough help, especially when it comes to treatment and medication?
I think the state facilities are overburdened at the moment, and I think currently most state facilities only cater to 10% of the sickest or the illest affected with mental illness. Awareness is still needed because this condition can result in a lot of chaos and dysfunction, and specifically for a woman. I mean, imagine having to keep up and juggling everything that we have to in life and not being able to because of medication affecting job, career, prospects. Some people, because of the impulsive spending as a form of escapism, can end up in quite significant debt. Small things that we take for granted, like road rage, reckless driving, because of the impulsivity, increased risk for substance and alcohol use. These are all the consequences of untreated ADHD.
All right, we've run out of time, but in 30 seconds, what do you say to people who don't know they've got it, might have it? What should they be looking at and thinking, this isn't just a thing I'm feeling, there might be something wrong?
So quickly, I mean, if anyone has symptoms, if you were the child that was the class clown, the chatterbox, always in trouble, so it has to have started in childhood and progress into adulthood, and you start something but you lose interest, you can't finish anything, you can't follow through. Please go to your nearest healthcare provider and get assessed, because there is treatment available, and there are also many non-medical ways to manage it as well, but the effective treatments available to help.
Dr. Lavinia Lumu-Thabete, thanks so much indeed for your time.
Thank you.
All right, so that's ADHD, which sadly is not diagnosed often enough amongst girl children and women. So we're shining the spotlight on this issue today.